Well, good afternoon, everyone. Thank you again for joining our live this afternoon. And our topic is discussion, second anniversary discussion, key partners. And I want to introduce our guests today. We do have Wilton Yazzie here with us today. He's the Chinle chapter manager. And we also have Milani Glass here with us, and she's the community support and outreach coordinator for Navajo Strong. And then also we have Lyle at City, formerly CHW supervisor, and for the Gallup service unit. And so he's now working in another capacity through on the Navajo Nation. So he's the principal program analysis for the Navajo Department of Health. So thank you guys so much for joining us today. And I'm going to go ahead and open up the floors for our guests to introduce themselves. And I'm going to go ahead and hand it off to Milani.
Hello, my name is Milani. As Mary said, I'm the Community Support and Outreach Coordinator for Navajo Strong. And we have been working together for, I guess, a few months now, helping one another to bring supplies down and kind of teaming up with our different teams to make sure that different items were getting where they needed to be and figuring out where that was. And it's been a joy to work with you. And yeah, with Navajo Strong, we're working on a lot of projects that are promoting more culture and youth empowerment and education, and still doing a few drives for supplies, but shifting more into longer term sustainability, farming and garden boxes, and yeah, just working together with all the organizations as much as we can.
Wonderful. Those are great initiatives. It's needed on the Navajo Nation. Let's see here. Walton, I'm going to go ahead and hand it off to Walton. Thank you so much, Milani.
Thank you.
Good afternoon, everybody. My name is Walton Yazzie. I work for the Chinle chapter government as a chapter manager. My clients are Hinela National, the SNA, Bashishin, the Twitch in the Shade, the we've been working with Navajo and Hopi for more than past 2 years now. We've been very good partners with them, and it's great to see all of you guys online. Good afternoon, everybody.
Thank you, Walton. Yeah. And next I have Lyle at City. You have the floor, Lyle.
Yes, yat Sena Ado yat Ashik Edoshadan Ash A Lyle at City Initiative. Ado din initially aid Sanjukin initially, Kachini Bashichin, Kapahe, Dashichedo, Sitnajini Dashanella. Unlay look until that I see Nasham the Dishan lay Tsidilia Sit Katawaliegi, Quashiaho Ado, Qua Cash and Ado, a larger Dasadagi, had Edigishu. Pelicana Bajigi ACHW supervisor Nashliman and Adisha, I was able to take a different capacity to fill a different role. So I'm excited to be here. Thank you very much for the invitation. Yeah.
Thank you so much for the for sharing an introduction. Yeah. So with further ado, I do have some. I just want to share how. How essential everybody has been, and everybody has been a very important piece, and they played a very important role to meeting the community needs. And a lot of the things that we're able to do would not have been possible without our partners. And with just supplies, and then logistics of moving things from point A to point B. Just people, our partners, of course, stepping forward and saying, we can, yes, we can. They're just really great in making sure that we didn't really have to ask twice. They just kind of volunteered, or they offered. So that is always great in a situation where you really do need help. So I really want to express our gratitude from the Navajo and Hopi Families COVID-19 Relief Fund. So I have some questions that I'd like to ask you. And then we can just kind of alternate, and then you guys can each answer. So what was it like serving in your role on the front lines and interfacing with us? And I can go ahead and hand it off to Gretchen, or I'm sorry, Milani.
What was it like being in the front lines and working with you? I mean, for me, it's always the most powerful and also poignant, working with people and being there, not just from afar. Especially, I don't live on the reservation. I didn't grow up on it, and I've been learning so much about the communities through the work that we've been doing, especially the one-on-one work with communities and families. So for me, it's been completely life altering, and something that I am, it's just the beginning for me.
Thank you. Thanks, Gretchen. And then Walton, you want to answer that question? And the question was, what was it like serving in the role?
Okay, it was very awesome. Starting this front role thing for the front lines, it changed a lot of experience of being from here as being a chapter manager, working as a chapter. Being on the front lines, you're actually seeing a lot of people that needed the help, needed the assistance, needed all the hard working, and seeing their eyes tear up when you go deliver when they were positive, or if they didn't have nowhere to go, nobody to call, no one to be how you say it. This thing came up and we weren't really prepared. The Navajo Nation wasn't prepared. The Chinle chapter wasn't prepared. When we came up, when I first emailed you guys, I said, hey, I need some assistant help. What can we do? So it was new to us too. So when we came up, we started off slow and we were learning off anything that happened, being on the front lines, being around exposed people, trying to tell them that 6 foot apart, mask. It was kind of hard because from the beginning you just see people suffering, coughing, sick. You don't even know if they were sick. You don't know if they were positive. So when we started, we all got together and we said, hey, we're going to do a risk. If you guys can't do it, I had about some couple of workers that did not do it, but for ourselves, we kind of took it on our hand and said, hey, we're hired for this. We can't run away from our people. We're here for a purpose. So when we started the front lines, like I said, we didn't only serve the Chinle chapter, we served all around the Chinle agency chapters, and even off most of the reservation and Navajo Nation, because a lot of the chapters were closed. And we've seen a lot of people that needed the help. I never seen it because I never really were out there at the same time until this happened. And you see the people that we helped. It was very heartbreaking. Some of us went into tears. Some of us broke down because we never seen the need out there. That was what we had to face. It was a very new to us. Interfering with you guys, helping us was one kind of great relief from the chapter side, because we didn't have the funds. We didn't have the necessary PPE gear. We didn't have anything prepared. And when you guys partner up with us, and it was so great that we could serve them their food, PPE. It was a very different look when we started. We didn't know that we could our bodies or our mind thoughts. We didn't know that we could do such a good job. And to this day, I always pat on the workers that stood beside me, no matter what it was, no matter if it was 14 hours a day, but they stood beside me. And then we done it on a purpose. And every single day we seen people that was really in need. So helping us and you guys being our partners really helped us. And we're really thankful from the Chile chapter side. And it made us think second thoughts about being, how would you say it, how people actually live out there. Because we never really went home to home until now. We actually went home to home, and we actually realized how much the need was. That's probably about it. Thank you.
Yeah, it's being able to see the homes and visiting some of the homes really does, it tugs at the heartstrings. Some of the stories that I hear from the team members, or, it does bother them. And, just really always thankful that, we're able to help these families. And it's just something else, very moving. When the first call for action was announced back in 2020, and it was scary, but at the same time, you had to find that bravery. And wow, there's bravery there. And so, just think back to that time. It was a really scary moment, scary time. Not being sure, there was a lot of uncertainty. So, yeah. Lyle, go ahead. Can you share your thoughts on that?
Yes, thank you for the question as well as the opportunity to speak. And like anyone else, this is something that we've never prepared ourselves for or never envisioned we would actually come across. And so it took a lot from us as individuals who are on the front lines, and our priorities are all different. And so a majority of the time I would volunteer myself, because the staff I had at the time were predominantly women, and they were very well capable of doing everything, the heavy lifting and everything like that. But I felt very unsettling to just be at the office all the time. And so I would take it upon myself to go out to the field and then do deliveries, as well as to just be mind blown and have my eyes opened up to this reservation that we live on, the lack of infrastructure, the lack of communication infrastructure, the lack of water infrastructure, the lack of housing infrastructure. And it really did sink in to know that we really aren't ready or prepared for anything if we don't have the necessities. And I think that's where you, as Navajo Hope Relief, as well as those other non-governmental organizations, were able to provide that aid of relief, to provide the necessities to actually help them successfully isolate or quarantine. It just had to wrap my mind around it all. Like, how are we going to help these individuals? How are we going to stop the pandemic? And now going into post-pandemic care, a lot of the times it's revolving around the psychological welfare of these individuals and the mental health well-being of these individuals as well. So a lot of times people do ask me, what do you think about the pandemic being in the past now, if you will? And I tell them it's one of those things of where we're going to have to find ourselves to be living with, just like the flu, just like all these other diseases out there that are here to stay. And the majority of the time in the Navajo traditional philosophy of living and thought processes is that you're never supposed to speak about it, because if you do, then it stays, it lingers, and it festers. And so a lot of times I try to find myself in both worlds, to where I'm speaking to an elder in the spiritual realm. And then I find myself transitioning, speaking to the younger generation, or in talking to them about the scientific aspect of things and how CDC is doing this, CDC is doing that. And then over here again, like what ceremonies that they can do and what prayers that they can recite and all these different things that they've actually explored and tried to actually to combat this. And we as Navajo people are resilient. And that's one thing I've always kept in my tool belt, was to say that these individuals, this is not their first rodeo. This is nothing that they haven't seen or been a part of before. And it really did strengthen the community by way of reaching out to your family, making sure they're okay, making sure grandma and grandpa were okay, re-emphasizing that family component, that family oriented approach to healing one another, and looking for that camaraderie among community members and non-governmental organizations like yourself. And I've even went out with the physicians, nurses that were non-Navajo, non-native, and they would call them Shiaja Oyat Eshik Isyat Eshana Yat Eshajad. They were giving them names, and they were asking, what does that mean? And I just told them, you're now part of their family, because that's what you're able to do, is heal them. And now you have a place to call home. So, and some of the physicians that were here from different areas were like, we've never gone to a society where tight-knit families were still able to be tight-knit families the way they are. And you have these multi-generational homes where you have grandma, mom, auntie, great-grandmother, Bitsoket, the grandchildren, all under one roof. And they were just astonished as to how much people were able to confine into one home. But that's just the norm, that's just how we grew up. This is how we were able to stay together as a family. So to go back on the question about how I see and what I witnessed, it was eye-opening. But in addition to that, it just restored my faith in the fact that we can always still call upon our family members to be there for us, as well as individuals that could actually come across to help us. And more so at the same time, it's just to relook at that resiliency. We didn't give up. We didn't back down, as people would like to mention. And a lot of debt of gratitude is owed to a lot of people that were on the front lines. And those that weren't on the front lines, like the epidemiologists, the people who are behind the desk trying to get all these numbers sorted for funding purposes, for reimbursement purposes. So a lot of people do deserve the stage and the spotlight, not just the frontline people. And it was eye-opening. It was just one of those things of where you want to make sure that you are very cautious about how and who you give thanks to, because there's a lot of people that are in debt of gratitude. And even the patients themselves, or the clients themselves, the constituents themselves, they in their way also help themselves to maneuver around these loopholes to say that, well, I don't need to go to the gas station or the store to get water. I can haul my own water. I don't need, propane. I can burn wood at home and heat my home that way and cook my food that way. So that's what I was saying when I was going back to the idea that it wasn't their first time dealing with something of this magnitude, but it really did touch the hearts of those that had passed on. And those individuals themselves found that resiliency to say that, okay, they've left, but yet we remain, and through them, through their memory, we'll go ahead and continue to live. And we still should be practicing 6 feet, but we as a Navajo culture want to, come together. We want to embrace. And I still have grandmas and grandpas coming up to me, hugging me, and I'm like, no, you can't, but you can't turn them away, you can't shy them away. And even the little kids, they'll come and like, can I hug you? I'm like, no, you can't, but okay, so stuff like that, that's just heartwarming as it was. And like Mr. Walton was saying, it really opens your eyes to go out to the deepest part of the reservation, to where you're off the grid, no cellular reception, no running water, no electricity. And you think, we are in 2022, 2021, 2020. How is this still possible? And sometimes the grandmas and grandpas are like, we're okay. I mean, we don't need help. This is how we are. This is how we were raised. And it's just like, that resiliency is what spoke volumes across this whole pandemic, as well as it continues to do throughout the duration of our time here on Earth. Thank you.
Oh, wow. Those are some really great points. And thank you for sharing that insight. Yeah, that is very true. We are resilient people, and it did show, it does show throughout the pandemic and before, pre-pandemic, people have these struggles, but somehow they maintain to keep things going for themselves. But we're just happy that we're able to lend a hand in any way we could during these difficult times. Which also gives me, a really interesting point that Lyle had brought up is, just, we weren't prepared. Yes, that is true. It was very apparent that we were not prepared. Which brings me to the next, into the next question is, what aspects of our work together did you enjoy the most? And then two questions in one, actually. And then how did you grow in leadership through our work together? And I could tell you, for us, with the Navajo and Hopi Families COVID-19 Relief Fund, we're going to do like a what could we have improved on, or what could we have done better type of an assessment on ourselves. So that is one thing that we've learned as far as growing. So can you share with me your perspective on that? And I'll just, let's see, let's go to Walton.
Okay. Working together was the most thing that I think we enjoyed was the challenge. The challenge of every single week. The workout that we used to get, we always look out for it. Just working and enjoying it was the most, because it got us, as being a manager and you have so many employees that work for you, we became a family. It was never, because every day we go to work and we see each other, and, they know I'm the boss and everyone knows certain things they do, and they only it's set to one thing, like one person, the office aide, and one person is only doing the operator. When this started, when we got all together, we got to know each other more, and we got to know more people. We got to know more people, not in our office, from other offices, from different entities, different families. We got to know ourselves. I think basically that's what happened. The first 6 months, we really didn't know each other's families, anything. And working with you guys opened our mind to every single thing that we had to think about. And then working side by side was, I had a, like, say, almost like a 911 call to you guys. I give you guys a call, or I give you guys a text. Hey, I need this. You guys never said no to us. It was a great thing that I could call up to you guys, say, hey, this family needs isolation. We're kind of behind. Can we serve these people? They're positive, or we need these people to get help. And you guys were just a call away. I didn't have to beg. I didn't have to do no 1 week to 2 weeks wait. You guys always give me the response as quickly as possible, and it inspires us all working together, and it can be done. I think open. I wish, like, hey, like a lot of them would say, we all know how to get together. If we all put our minds and hearts together, we can all help each other. Not just watching certain people do on certain things, and that's what I think we learned the most. The leadership through all working this, I think every single my employee grew to be somebody. They all left. Some of them left, some of them stayed. A lot of them stayed with us. They inspired about being actually taught about the old ways, your grandparents, your nollies, your uncles, your aunts, what they taught you when you were young, what they taught to you about, hey, you're supposed to help, you're supposed to say yat shamashi yesh, and shamasan. We never really taught like that until we started delivering. We see the grandmas yat shama yat ja, and you started using your old language back, because when you go out there, you think that it's lost, but it brought us back. Like I said, it brought us back into what we really here for, and what our parents, our mom, our dads, our grandparents taught us how to speak. We don't speak that way, but now it made us speak that way. It just made us more understanding of what we're here for, what we've done. I don't know if a lot of my workers say, and we all give each other's hugs, and we're just like, man, we did it. we see the timelines on our Facebook or our Snapchat where we got stuck, and then we get these direction, how you say that, second tree to your right, fourth tree to the right. It was so fun. That was just a fun part of delivering, and you get lost. But you know how Navajo Nation is, you don't have streets, you don't have no signs, you just, you know, you do your best judgment to get to that area. But it made us grow. Like I said, it made us a better person inside leadership, understanding what people needs are, what our people are really like out there. I know a lot of people think that some people are really bad people, but way out in the boonies, I say, but you know, they're really thankful when you showed up there, and it was like, man, I never seen someone come out and thought you guys could find us. It made us tougher, made us stronger, made us think more positive about people. Like I said, if you work here like 8 to 5 and you know you're just doing your daily work, daily jobs, then this happened and it makes you just better yourself and think positive on the big end. But thank you again, guys.
Thank you. Thank you, Wilton. So the question that I asked earlier is, what aspects of our work together did you enjoy the most? And that's the first question. And then the second question is, how did you grow in leadership through our work together? And I'm going to go ahead and choose Alani. Is Milani frozen? I think she is.
I can't speak. Am I frozen?
There we go. I see. We
Yeah?
see now.
Okay. I can turn the video off for a clearer voice, but I can't speak to the same depth capacity in terms of working with you, because I think we had more of we were updating each other online, and I was on the calls and just really keeping up to date with the work that we were each doing. But I can speak to doing those distributions, and I relate really well to the fourth tree on the left and getting lost in the boonies, as you said. And what really amazed me about the way that Navajo and Hopi Families Relief was doing it, it was so, your persistency and your organization was very inspiring to us and mind-blowing, because we too have been doing a lot of runs down there and bringing supplies, and just seeing the way that you had your teams lined up and it really had everything in order. The boxes, the PPE, everything was very impressive to us and inspiring. So it was really nice to work with you and to have that level of like this, you know, it's almost like it's like a factory machine. This goes here, and everyone's working together, and we can't get anything done without that. So to what Walton said, yeah, at the end of the day, it's been amazing to me to see how much we're capable of when we all come together, and like the incredible force that humans have and how much we can accomplish when we all have similar visions and just are proactive about it. So.
Well, thank you. Thank you, Gretchen.
Am I still here? Am I frozen?
Thank you, Milani. Thank you, Milani, so much for that insight. But yeah, I have to credit our teams, and they just really honed their skills. They've sharpened, you know, their packaging, the process, and all the way down to the reporting, and just, you know, making sure that they did what they're supposed to help these families. So they just were awesome. I'm gonna go ahead.
Including the perishable goods and the meat goods. Wow.
Yeah, we had to be very choosy and just very let the vendors know we need fresh produce, and we need, you know, fresh fruit, everything. It needed to be fresh. We wanted the best types of food for our families, Navajo and Hopi families. So thank you. I'm going to go ahead and move to Lyle.
Yes, thank you. Um, just jumped right out the gate. We kind of took quite the contrary. We didn't focus on fresh fruits and vegetables for the first portion of things because when we were called to activate, if you will, and we were like, okay, what needs to happen? Let's take an inventory about what we have and what we know. So we immediately, a team of three of us completed a community needs assessment based on the continuance of data that we had here with our teams that were comprised of, all arrays of demographics that they cover, people with maternal and child health, people with the senior centers, people with different areas of specialties that they are included in. So we got a community assessment completed with the help of the Division of Community Development, the chapter houses, and we got an assessment as to what was out there and what we're able to deal with. And so we took the approach of using non-perishable food, stuff that had longer shelf life, because for the time being, from CDC's advisements and guidance, was that they have to quarantine or isolate for 14 days. And we're like, well, some of these homes don't have refrigeration, some of these homes don't have electricity, some of these homes are, have roads that are impassable. So we took the approach of non-perishable food, and they kind of got tired of that. I would too, but that was just something that we were able to start out of the get-go because we had the whole entire Navajo Nation and the border towns like Winslow, Farmington, Gallup, but as well as our satellite locations like Rama, Tuahajile, and Alamo. So we would try to take all into consideration. There was only three of us, and as Mr. Walton said, some hours a day were actually 15, 14 hours a day. We were still here at work, and we literally just kept pumping out numbers and getting these assessments completed and seeing what was needed for the community. But I think one aspect that spoke volumes again was just what it was communication, what lack thereof, but as well as what streamlining needed to take place. There was so much broken communication among tribal organizations to healthcare facilities from 638 all the way into counties. And it was just like we were all siloed. And we were all doing different things. And in a manner of speaking, we're duplicating services. And then we're like, wait, hold on, let's come together, let's wrap our heads around this. How can we stop duplicating services? How can we enhance the communication? How can we enhance just streamline that communication better? And we looked at all these best practices out there, and we tried to stick with one. And it wasn't perfect, but we did get what we needed to get done to get these individuals what they were requesting, but as well as to strengthen that communication with the healthcare facilities and us. And so it came down to actually working with the clients one-on-one by calling them, asking them, how are you doing? How are you feeling? And providing that individual health education over the phone. This is what you're experiencing. There's no reason to panic. So if we do panic, this is what you need to do, and this is how the hospital will be able to accept you. There's a protocol in place, and all of these things needed to happen. Then from there, we went to mass media. We went to different social media platforms, Facebook, Instagram. We even tried Twitter, but that didn't really work or take off for us. Then, of course, our stronghold, which was the radio station. And so we start broadcasting a lot of public health or public information, snippets of what needs to happen, and what, if you feel this and feel that, this is what you should do. And of course, the president office did initiate an executive order for a stay-at-home shelter. So that in one way was to mitigate COVID-19. And it was all about communication. And what helped me to grow as a leader was to communicate better, to be mindful of other people's interpretation, but to also be mindful that you don't really deal with people, you deal with personalities. And what that actually means to me is like, you have a person, but you have to strategize how to reach them, how to be more impactful. How is your message going to be? How is it going to resonate with them? And that goes back to what I was saying earlier about having to modify my teaching into two different worlds, where on the spiritual level or the more guided meditation level of speaking to an individual would be the elders. They do well with open-ended questions. Okay, tell me more about, how do you feel? Like stuff like that. Like, those are close-ended questions, but probing them for more information. And Walton can probably speak to it. Maybe even you, Mary, can attest to this. Like, the elders just want to be heard. They just want someone to speak to. And sometimes they're like, your patient consult should only be 15 minutes. I'm like, that's not going to fly. Sometimes my consultations will go from an hour to 2 hours. My visits will go from 15 minutes to 1 hour. And then on the other side of the spectrum, you have the younger generation where they're like, okay, we understand. What does this mean? What does that mean? And we tried to very tread lightly by allowing the people to empower themselves by doing their own research. But we try to also remind them to be cautious on where they seek their information and where the credibility is coming from, because you'll go to, okay, I have a scratchy throat, I'm going to WebMD. You have a list of different things that says that this is why you're symptomatic and you could be COVID positive. And you start causing havoc and people running into a frenzy. And you see grandma loading everybody up into the van and like, oh, we're going to go get tested, let's go. But that wasn't always the circumstance. And then with the healthcare workers themselves, they took on a great burden for the testing strategy. And we came up with all these strategies and these different committees, if you will, to talk about testing strategy, vaccination strategy, team meetings. And I think what we can say that we walked away with this, and the one greater aspect that actually was better for all of us was just communication, but as well as accountability. Accountability was where it was at. If we weren't able to reach grandma or grandpa that certain day, we took it upon ourselves to make sure that we were able to call them, to connect with them somehow, to let them know we won't be able to be out there this day or that day. And one thing that I always remind myself is that we're not just serving the community, we're rebuilding trust, restoring faith in the fact that these individuals, the constituents, can now rely and trust in these partnerships that are out there, and don't turn us away immediately just because we weren't able to fulfill a request, but work with them to make sure that they understand, that we're up against this. This is what we're having to deal with. So logistically, we can't get there in time, but we will eventually. And just trying to rebuild that trust and rebuild and restore that faith in the community as well as communication is probably what it was. So as a leader, I grew through communication, but as well at the same time to be more patient, but at the same time not to freak out. And I didn't really see myself as a leader. I much more or less see myself as a team member. We were all equals that day, and we still continue to be this day. I'm not going to stand there and say, this is what you should do. I'm almost like a dictator, if you will. I would stand there beside my team and let them know that I'm here to help you. How can we help them? So team-oriented approach, and I've seen all individuals, even if they were my staff, as a team member, not as their supervisor or leader. But when push come to shove, I did have to make decisions to, make sure I'm looking for the well-being of my staff first and foremost, but as well as their safety as well. And then thereafter, the community's needs as well were then sought after. Thank you.
Wonderful. Thank you for that insight, and everyone. And just, it's been a journey. It really has been, just learning from, what we've gone through, and using, I guess, deciding on a new direction, or, ways to implement the leadership is definitely a learning curve. And, it's, we're all learning and growing. Thank you so much for answering those questions. And I'm going to go ahead and ask the last question. And this can just be like a really, simple answer. But, what was what did you learn about diversifying a partnership? And then how do you think that impacted your community? And I'm going to go ahead and start with Milani.
I'm not sure I understand what you mean by a diversifying partnership.
Okay. Well, I guess it would mainly be with with the chapter, or the Navajo Nation program with the CHW. So, you know, typically they work with the Navajo Nation. And then so here we come, you know, nonprofit organization. And so, that's what I mean by the, you know, diversifying partnership. So, I mean, if there's like a relevant, if you see any relevancy in that, you're more than welcome to answer, but if not, then that's okay. And then, or just seeing the impact. You know, the second part of the question is, you know, how do you think that partnership has impacted the community?
Yeah, I think, as I said before, the more people working together, the more we can accomplish.
Mhm.
And for me, in terms of the work we do on the reservation, it's all, for me, it's all eye to eye, heart to heart. And the more we can personalize those relationships and personalize even our connections to each other as organizations, the more we can get done and the more positive hope we can have for how much we can get done in the future. So I guess that's how I can answer it. I think I'm still not fully understanding the question, but yeah.
Okay, all right. Thank you, Alani. Thank you so much
Thank you.
for answering the best you can. I mean, you know, working with Navajo Strong and just, you know, having you available to us. You know, we do a grassroots. Well, it started as a grassroots monthly meeting, and now like weekly, and I think now it's like every other week. But thank you for, you know, showing up every time and just showing your support and just being there and sharing, you know, what you guys are doing with the communities that you serve. And it's inspiring, you know, all the way around. So thank you very much for
It's inspiring all the way around. Thank
Yes.
you as well. I'm so grateful to work with all of you, and I'm going to hop off now. And thank you for the other connections with the Western Navajo Fairgrounds.
Mhm.
We actually have a whole bunch of firewood right now if anybody needs that or has a place for it. But connecting with Ames and the fairgrounds has been so important for us. So thank you. Let's keep connecting. And it's
Awesome.
nice to be here and to meet you all.
Thank you so much.
Ahe.
Bonnie. Have a good day. And then I'm going to go ahead and move over to Lyle. So if you could just answer that question. The question that I had asked is, what did you learn about diversifying partnerships? And then how did that impact your community? And I think you've answered some of those questions in earlier, you know, your earlier shares.
Thank you, Mary, again. And to Ms. Milena, I don't think I've met her before, but that was just cute. She's like a cat. So awesome. Diversifying, you know, the partnerships has done great things for us. It allows us to share the responsibility, you know, with other partners that want to be involved. It allowed us to open the doors to these individuals that wanted to be a part of combating COVID-19. It allowed us to, you know, share, you know, best practices with each other, to bump ideas off one another, and to, you know, just have this mirroring effect to like, oh, okay, this is what you're doing. Okay, this is what we're doing. So having to look at yourself from a different perspective, like, oh, okay, well, maybe we should have did it this way, you know, strategizing and then re-implementing the idea shared among these individuals that have a different approach on a different take on things. And that's one thing that we really capitalized on, is when we had people that were coming from John Hopkins, people that were coming from Navajo Hopi, you know, they had best practices and they've done things like this before us, and we learned from that. And that allowed us to be closer to the community. That allowed us to respond more quickly to the community's needs, instead of having to create all these processes over and over again. And like these were already created, and these steps were just having to be implemented. And of course, some practices weren't pertinent to the Navajo Nation, like metropolitan areas from Phoenix, Washington, D.C., Seattle, Washington. Like what was working there might not work here, but we can tweak it to make it look like it's going to reflect this change. And that's how it can benefit the Navajo Nation as well as the communities that we serve. So diversing your partnerships can benefit you, but as well as at the same time, it can also, bother you, because you're going to have to share that data now. Now, who's going to have ownership of this data? Because we've each pitched in now. Who gets the data? Who gets to claim the numbers, if you will? So we'd have to be cautious on that part too, and tread lightly on that part too. And then for reimbursement services, as well as for accountability, all that good stuff. But it did help us to respond quicker to the people, as well as to not create and spend too much time creating new processes that were already in play. And what was the second part of the question, or was that it?
That's it. You answered you answered perfectly. Thank you so much, Lyle. And then we'll just go ahead and move over to Walton, and then we'll go back to closing remarks, and that will conclude our session. So go ahead, Walton. You have the floor.
Okay. What I learned on this partnership. You guys were the first one that we partnership with for the first 2 months in this beginning. So I kind of learned how to reach out to other entities. So out of this whole 2 years that you're not the only one that we partnership with. I have partnership with 17 other entities, donators, from mass PPE gears, from little shed for little homes that people had no place to live, the woods, water, got a bunch of water barrels, getting some. I reached out when I started learning how to partnership with you guys. Like I said, it was new, but I said, hey, if we can partnership with Now and Hopi, we can partnership with other people. Let's go reach out and do more. That's why, like you guys know us, we're busy constantly. Then we got into water, getting water barrels, hauling in the middle of the night at 12 midnight. We've done a lot. Learning how to partnership, and like I said, there's a lot of people that were intending to help, but under the Navajo Nation, I don't know if they were embarrassed to ask for help, or too proud to ask for help. But for us, the Untitled Chapter, since we became an LJ certified chapter, we can make our own decisions here at the chapter. Our chapter president is the only one that can say, hey, yeah, go ahead and do it, or no, the manager, you can't, or some of that nature. But we just reached out to every partnership that we could get. We got, like I said, we got donations of cloth masks. We got donated over 1 million cloth masks the first month that we started. Water, like I said, water barrels, woods. We got donation for different kind of entities that bring out water. I think Walmart gave us like 3 semi-loads of cases of water, and we were just passing out things that left and right what we could done. That made us learn. That made me learn how we can be partnership, and we can do it if we all just reach out and ask somebody. We always don't like asking. I don't know, us natives, we don't like to ask. We're just too proud to, how you say it, somebody to help, ask them, hey, come over and help me. Or, a person that's broken down out in the parking lot, they'll just look at you. They won't actually come out and say, hey, can you give me a hand, or can you help me out? Or I don't know if we're just raised that way or what, but I reached out, and boy, we got a lot of feedback, and that was great. Then how it impacted our community was, like I said, we didn't only help the Chilean community. We helped so many communities surrounding us. Even Hard Rock, we took like little homes out there that they couldn't live in. We built homes, and there was a construction company that we were working with, and a church group that we're working with in Phoenix. They bought all the lumber. People had burnt down homes and stuff, and they're always asking, how can you guys do it? I said, no, it's everyone needs a lending hand. And they used to come out, they gave us the supplies, and we had schedules after schedules. And impact a lot of people that people that didn't have water barrels. Like I said, we gave it to them for free, and all these other entities pitched in. I know the nation asked me one time, where in the world are you getting all this stuff? I'm like, partnership, reaching out. Why do I supposed to ask permission? You know, I was kind of that person that always said, why am I gonna ask permission? It's for our people. Our people is the one that is in need. I don't need to sit here and wait. I need to jump on it. We're front lines. We had to help. We can't just sit here and watch and suffer. I said we need to assist. So doing all the partnership that I done and with all different kind of different people, it was great, and we learned a lot. And this year, I think under your wood program that we done with Coconino, we reached out. Now we're contract with over here in Colorado, and we got semis and semi loads of woods. And just from learning from your partnership, reaching out to different entities, then we reached out to them too. I was like, hey, are you doing it this year? Can we join into your group? Can we, we'll lend a hand, we'll help you here. We never really reached out and said, just do it for me. For us, we'll say, hey, we'll take our vehicles out there, we'll have our workers out there, we can help upload, we can help do this. It was more like a 50-50 relationship through all our partnership. But like I said, you made us learn on Nav and Hopi. You made us aspire more people than what we thought we could be. Learning from the partnership from you guys were just the great. I know we had the hiccups up and down, but we all learned. We all learned a great deed, and it just very aspiring. 2 years from now, we're still partners, and we're still helping each other, and we're still assisting each other in ways. But that's what we learned in our community. Very appreciate every single help that you guys have done, especially our schools. We even assist the businesses here. We gave them PPE that you guys gave us. We gave them to their workers. We went to every single stores here. How much workers do you have? Here you go, and be safe. Then we go down to mini farm store. Then we go up to saline store. Then we go to Pinion stores. Hey, here you go. Here you go. This is from Nava and Hopi. We never just stayed here in Chinle. If we did, they probably wouldn't have made us open our eyes, but we did. It wasn't just, I know chapters are only for chapter voters. And I know we're always stuck to that. We only help Chinle chapter because we're Chinle chapter, but it made us go out into the whole Chinle agency. And that was the greatest thing, that we actually can do it if we all work together. And if one chapter can oversee 16 chapters, what could we have done if all 16 chapters helped each other? Not only one chapter doing all of it. I mean, that was one great thing. I said, man, we're running the whole central agency. I said, we're watching over so many registered voters. I said, over 10,000. I said, we're watching all of them, all 16 chapters. I said, what's going on? But if all of them helped out and assist each other, it would have been a very easier route. And I wish we all do a partnership, but a lot of people don't like partnership because they just don't like being told, I guess. But thank you again. Made us, I did learn a lot. Like I said, I reached out to 19 different partnerships I had, including you guys. Thank you.
Well, ladies and gentlemen, that really concludes what our session has been. And so, Walton and Lyle and, all the organizations that we have worked with, it's just, we have immense gratitude for everybody coming together and making things happen. And, it's just amazing how everything came together. And then, Walton, what he's mentioned before, he's like the model for resourcefulness with Chinle chapter. And it's amazing what Chinle chapter has done. And, it's just very inspiring all around again. And so I wish we had more time, but we're going to go ahead and conclude our live here really soon. But I have a list of some of the partners up here on my left hand side. I did forget Standing Rock chapter. They were essential in partnership for to cover the Eastern Navajo part of the Navajo Nation. And so they were able to, you know, receive supplies as well. And they had the reach, they had 19 chapters they could reach as well, you know, with, you know, as well. So anyways, I just wanted to mention that, but thank you so much. Have a good afternoon. And hope you guys all take care. So there is another session right after this. So go ahead and join that one if you will.
Me too.